There are 3 main skills you will learn in this lesson. You will learn how to measure the mean sac diameter and crown rump length to estimate fetal age. You will also learn how to choose the best ultrasound images to determine fetal age. This last skill refers to assessing both the position of the fetus and the quality of the image itself, so you will need to use your previous knowledge of echogenicity, gain settings, and depth that we covered earlier. In the first trimester, the size of the fetus does not vary as much as it does in the second or third trimester. Therefore, fetal age will be more accurate if you measure it in the first trimester using the first sonogram that can find a yolk sac or fetal pole with a heartbeat. An ultrasound without a yolk sac or fetal pole and heartbeat is too early. Once you determine the due date by an early pregnancy ultrasound, do not change it based on a later ultrasound. These are sagittal and transverse images of the uterus showing a collection of fluid. Here we have labeled the gestational sac, which is the fluid sac that contains the fetus. In a very early pregnancy, you may see a gestational sac without any other structures. This sagittal image of the uterus also shows a small fluid collection. This could be a gestational sac, but sometimes fluid from other causes can collect in the uterus and look like a gestational sac on an ultrasound. This fluid could be from a miscarriage, bleeding, infection, or a pseudosac of an ectopic pregnancy, which looks similar to a gestational sac. This is a sagittal scan through the uterus in early pregnancy. The bladder is above the uterus. Here you can clearly see a gestational sac inside the uterus. The small circle in the gestational sac is the yolk sac. A yolk sac can first be seen before the fetus becomes visible at about 6 weeks gestational age. The yolk sac provides nutrients to the developing fetus. The way you estimate the age of a fetus depends on the stage of pregnancy, or in other words, what you can see on the ultrasound. The first sign we can usually see of a possible pregnancy is a gestational sac in the uterus. A yolk sac, however, is the first reliable sign of an intrauterine pregnancy. So if you can't see a clear yolk sac, it is too early for fetal dating. Ask the patient to return in 2 weeks to confirm the pregnancy. This is another normal early pregnancy without seeing a fetus. This sagittal image shows the uterus, gestational sac, yolk sac, and fetal membrane. Please pause the video now to identify these structures within the group. Here we have outlined these structures. A thin membrane is sometimes seen early in pregnancy, but usually not later unless you see the membrane between twins. A yolk sac is a definite sign of a uterine pregnancy. If we can clearly see a yolk sac on ultrasound, we can determine the age of the fetus by measuring the gestational sac. This method uses a measurement called the mean sac diameter. If we see a yolk sac, we also know that there is an intrauterine pregnancy. We can be confident that the patient does not have an ectopic pregnancy outside of the uterus. Note that there is a rare situation in which a woman can have both an intrauterine pregnancy and an ectopic pregnancy. This is quite rare, but more common in women who have undergone in vitro fertilization to improve chances of pregnancy. To find the mean sac diameter, follow these steps. First, measure the greatest length, width, and height of the sac. Then add these numbers and divide by 3. Finally, find the number on a standard table to estimate the gestational age. Many machines will have a built-in program called an OB package. If you have the OB package, then make 3 measurements and the machine will calculate the gestational age for you. Otherwise, you must do the math yourself. It is very important to make precise measurements so the gestational age is accurate. Please pause the video now to find the gestational sac measurement chart in your participant handbooks. Please ask your trainer to show you how to find the gestational age from the mean sac diameter. If you do not have a participant handbook, please download from the website shown on the screen. This is a transverse scan or cross-section of the uterus with a gestational sac that will be used to measure the height and width of the gestational sac. The echogenic tissue around the sac is normal and is shown here. Be sure to measure only the fluid, not the echogenic tissue. If you include the echogenic tissue, the fetal age will be too old. The correct area to measure is shown by the calipers, and the measurements are shown on the lower left. Please note that we will use these numbers for a gestational age calculation in a few slides. This is a sagittal scan of the uterus that will be used to measure the length of the gestational sac. Now we have the last of the three measurements to calculate the mean sac diameter. Now that we have length, width, and height, we can calculate the mean sac diameter. When we add these numbers together and divide by 3, we get a mean sac diameter of 1.4 centimeters. On some machines, the length, width, and height measurements will be called D1, D2, and D3, referring to 3 different diameters. Please pause the video now to use your gestational sac measurement chart to estimate the gestational age that corresponds with this mean sac diameter. The answer is 5.6 weeks. Let us review the methods to determine fetal age. If you see a gestational sac but no yolk sac, ask the patient to return in 2 weeks for another ultrasound when she is farther along in her pregnancy. If you can see a yolk sac, measure the mean sac diameter. The last method to find fetal age can be used when you see a fetus on ultrasound. If you see a fetus with a heartbeat, the best estimation of gestational age is made by measuring the crown rump length, or CRL, which means measuring the length of the fetus from the crown of the head to the rump. The crown rump length is very accurate for determining gestational age if it is done correctly before 14 weeks and varies by 3 to 7 days from the actual age. With a very early fetus, we always measure the greatest length of the fetus, but never include the yolk sac, which is usually located right next to the fetus. Here we have labeled the fetus and the yolk sac. This is an example of a correctly measured crown rump length. It does not include the yolk sac, which is located very close to the fetus. This is an image of a very early fetus at approximately 7 weeks. If you see a fetus, look for the heartbeat. Remember that we must have a heartbeat in our ultrasound protocol for fetal dating. If you can't see the heartbeat, send the patient to your referral hospital. Notice the calipers, which appear as small white crosses that measure the crown rump length. The crown rump length is the greatest length of the fetus.